Hello my juniors, welcome to another biochemical lecture series. So great science to Lorenzo, and today we'll be doing Eicosanoid Metabolism, which is the metabolism of what 20 carbon fatty acids. It says 13 carbon fatty acid, 18 carbon fatty acid. So essentially it's just polyunsaturated fatty acid, but this eicosanoid is 20 carbon. So you get it now. So but the 20 carbon we'll do is also derived from some essential fatty acid. I'll also be explaining to you. So this one just covers mainly the essential fatty acid metabolism. You get, so we call it eicosanoid. Echo 20 carbon. You get it now. So if you are new to my channel, make sure to subscribe and turn on your post notification button, so at any time I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section, and I promise I'll make the video for you. So this one is very, very important because you always need it for exams, and when you are doing pharmacology, when you do autocoids too, autocoids medications are here because you have NSAIDs from this pathway. Are you getting me? Your NSAIDs come from this pathway, and also your prostaglandin analogs too comes from this pathway. So majorly your autocoids are here, so you have to read it and understand it very well, because most of this cause natural local inflammation. Leukotrienes, your prostaglandins, your autocoids, all of them, they are all here. So let us jump right into the video. Now first of all, you say what essential fatty acids? So essential fatty acids are fatty acids that your body cannot synthesize. Your body cannot synthesize them, so you depend on diet to take them into your body, because if they are not there, they can cause significant damage. Are you getting now? Because most of all these essential fatty acids produce some derivatives in the body that are useful, like prostaglandin. Prostaglandin is 100% useful. Thromboxane A₂ is so useful. Prostacyclin is so useful. Are you getting now? So the only one that causes pathological damage is leukotrienes, but most of them are 100% good. Are you getting now? Because it is very, very important that they have them in the body. So, and they are derived from what? Essential fatty acid. But your body cannot make them, because your body do not have the important enzyme to make them. So your body depends on diet. You get it now? So now they are called polyunsaturated fatty acid. Polyunsaturated fatty acid because we have saturated and unsaturated. Saturated do not have double bond. It has single bond, which I gave you in my last video when I did fatty acid synthesis. So single bond. So you have butyric acid, cationic acid, you have stearic acid, you have palmitic acid. These are 20 bonds with single bonds. While unsaturated fatty acids have one or more double bonds. Are you getting that? So you have oleic acid, you have linoleic acid, you have linoleic acid, and you have arachidonic acid. So they are polyunsaturated fatty acids. You get it now, which are regarded as saturated. Are you getting now? They are regarded as saturated because your body take them from diet. So one thing you have to remember: essential fatty acid, my body takes them from diet. Are you getting now? Because there are no enzyme to form them, but they are highly important, because if you reduce them, they will not produce some derivatives in the body. Are you getting now? If they don't produce derivative in the body, it's so bad. E.g., you have linoleic acid. Are you getting? Which is 18 carbon. So linoleic acid is 18 carbon with 2 double bonds in position 9 and 12. 2 double bonds in position 9 and 12. And they also have carboxylic group at their end of their carbon. CHOOH, COOH. Are you getting now? Are you getting that? So you have linoleic acid. Linoleic acid is also 18 carbon, but it has 3 double bonds in position 9, 12, and 15. Arachidonic acid is 20 carbon. Are you getting that? 20 carbon with 4 double bonds in position 5, 8, 11, and 14. So these are what polyunsaturated fatty acid. The one that have one double bond is what they call it is oleic acid. So oleic acid is the simplest form. Now, one thing you have to understand that specific essential fatty acid are linoleic acid. So linoleic acid is a specified and essential fatty acid alongside the linoleic acid. So linoleic acid and linoleic acid are the essential fatty acid. Arachidonic acid is just a semi-essential. It's a semi-essential because in children they are essential, in adults they become semi-essential. So but they are usually semi-essential, while linoleic acid and linoleic acid are essential. When the body cannot produce arachidonic acid, what happens? You now form them from linoleic acid. Essentially, your body can produce them, and sometimes that's why they will say it's semi-essential. So it can be non-essential, sometimes it can be essential. If your body can produce them, fine. If your body cannot produce them, they are formed from what? Linoleic acid. Increase in linoleic acid do not directly increase arachidonic acid. Linoleic acid can be increased on its own, but when it is so increased, most times it can form arachidonic acid. But the body has a regulatory mechanism, I get them, that inhibits arachidonic acid formation when you increase the linoleic acid. So when you increase linoleic acid, the mentality here is that it can form arachidonic acid, but most times, due to some regulatory enzyme, your body do not form arachidonic acid anytime there's increase in linoleic acid. So arachidonic acid naturally is formed from linoleic acid. You get it now? But sometimes your body produces them. You get it now? So one thing you have to know, in the general note, you should know that eicosanoids are what? Biological active compounds. They are biological active compounds. That is the first thing you have to know, which are derived from 20 carbon polysaturated what? Fatty acid. So they are biological active what? Active compounds derived from 20 carbon polyunsaturated what? Fatty acid. Are you getting now? So the eicosanoid there is the arachidonic acid. The eicosanoid there is the arachidonic acid, and they are biological active. They are very, very important. Because sometimes during inflammation or doing some conditions that need these things, what happens? Your body start forming them. I get them now. Your body can form them from what? Phospholipids, from the what? Cell membrane. I get them now. Your body can form them from linoleic acid. So it depending 100%. So now, what are the functions? So they are local hormones. That's why I call them autocorrects. They are local hormones. They act locally within that region. So they also help in inflammation. Inflammation is a good thing to some extent, because during inflammation, what happens? Your body mobilizes white blood cells to the site of what? Infection. But in doing that, inflammation will cause some acute inflammation signs like pain, swelling, redness. Are you getting now? Which are so bad. Inflammation, immunity, because I told you there will be recruitment of what? White blood cell. Platelet aggregation, yeah, there will be platelet aggregation. Why? Because there will be release of thromboxane A₂. So in thromboxane A₂ here, it helps in platelet aggregation. Regulation of blood pressure. I get it now, because hey, in presence of this, sometimes what happens? Sometimes the blood pressure will drop, and when there's inflammation, so it helps in blood pressure regulation, smooth muscle contraction, allergic reaction. So eicosanoid is arachidonic acid. Arachidonic acid is 20 carbon fatty acid, which can be semi-essential. So major eicosanoids are arachidonic acid. So arachidonic acid is a major eicosanoid, but it can be breaking down to what? Prostaglandin, prostacyclin, thromboxane A₂, and leukotrienes. Prostaglandin, prostacyclin, thromboxane A₂, and leukotrienes. But basically, it is prostaglandin and leukotrienes. Prostaglandin and leukotrienes. I get it now. But prostaglandin now have derivatives. We call them prostanoids, which are prostacyclin, thromboxane A₂. You get it now. So eicosanoid, 20 carbon fatty acid, which are polyunsaturated, 4 double bonds. I get them now in position 5, 8, 11, and 14. Linoleic acid, 18 carbon, 2 double bond, 9 and 12. Linolenic acid, 18 carbon, 3 double bond, 9, 12, and what? 15. I get them now. So both of them are saturated fatty acid. Both of them are essential fatty acid, while arachidonic acid is a semi-essential fatty acid. So where is the site of eicosanoids? So eicosanoid occurs in the liver, I get them now, in the kidney, in the muscle, and other tissue. Why? Because they are surrounded by what? Cell membrane. So cell membrane is what covers most of our cells, but basically the cells that are usually triggered to release eicosanoids are liver, kidney, muscles, and other tissues. So the concept to remember here is essential fatty acid, you get what? Arachidonic acid. So arachidonic acid are eicosanoids, which are what? Local hormones that helps in what? Regulating inflammation, immunity, platelet aggregation, regulating blood pressure. Are you getting now? Smooth muscle contraction and allergic reaction. So we want to go into the biochemical pathway of eicosanoid metabolism. So first of all, before we go there, we have to what? Synthesize what? Arachidonic acid. So it is very, very important. It's very, very important. Remember, in our cell membrane, we have the lipid bilayer, we have a lipid bilayer, and in the lipid bilayer we have majorly phospholipid, cholesterol, phospholipid and cholesterol in the lipid bilayer. So the phospholipid has a head and a tail. So we have a hydrolytic head, an hydrophilic head, and a hydrophobic tail. In between the hydrophobic tail, you now have a cholesterol, which helps for structural what? Integrity. I get it now. So that is one important thing you have to what? Know. So since you have understood that part already, which is so important, so the next thing here is that phospholipid now in the cell membrane, if you break down that phospholipid, in the presence of phospholipase A₂, you get arachidonic acid. In the presence of phospholipase A₂, if you break down phospholipid, you get what? Phospholipase A₂. Are you getting me now? Now, phospholipase A₂ hydrolyzes the ester bond. Are you getting me now? In the second carbon of position in the phospholipid. So it hydrolyzes the second carbon position in the phospholipid. So if I hydrolyze the phospholipid with phospholipase A₂, I'll get arachidonic acid, and somehow releasing what? Lysophospholipid. Are you getting me now? So also using phospholipase A₂, I can get arachidonic acid and lysophospholipid. Are you getting me now? Lysophospholipid. But now phospholipase A₂ can be inhibited by what? Corticosteroid. Corticosteroid can inhibit phospholipase A₂. Are you getting me now? So when you give a patient corticosteroids or glucocorticoids, what happens? They are the same thing. When you give a patient glucocorticoids, which is cortisol related, so you are increasing the cortisol level by giving them glucocorticoids or any corticosteroid drugs, you are inhibiting phospholipase A₂. So we give a patient glucocorticoid or corticosteroid to what? Inhibit phospholipase A₂, thereby dropping the formation of arachidonic acid. So if I drop the formation of arachidonic acid, do you know what I'm doing? I am inhibiting inflammation. Your body always breaks phospholipase A₂ when there's increase in inflammation. So when I give a patient corticosteroids, what do? I inhibit phospholipase A₂, breaking down and destroying the formation of what? Arachidonic acid. So if I do not have arachidonic acid, I don't have leukotrienes, and if I don't have leukotrienes, I don't have prostaglandins. Because in the presence of this inflammation, you are dropping the blood pressure, you are causing edema, you are causing headache, you are causing increase in intracranial pressure, you are causing anemia. So when a patient comes to you with unexplained fever, and you have carried out your analysis and you have not seen what is causing the infection, what do? You increase what you call corticosteroid. So corticosteroid helps you keep the patient for that while, but in doing that, what are you doing? There's no inflammation, which means there's no increase in white blood cell. So when there's no increase in white blood cell, you have made the patient immunocompromised. So the patient will be immunocompromised because of why? There is no inflammation. So inflammation can be good to help us recruit white blood cell, and it can be bad because it will drop the blood pressure. Now, using arachidonic acid, what do I do next? In arachidonic acid, I can use what we call cyclooxygenase. So if I use cyclooxygenase, what happens? I'll form prostaglandin. If I use 5-lipoxygenase, I'll form what? Leukotrienes. So now the derivative of arachidonic acid is prostaglandin using cyclooxygenase COX, and using 5-lipoxygenase, I will use what? To get what? Leukotrienes. So with prostaglandin, I get it from COX, which is cyclooxygenase, and with leukotrienes, I get it for 5-lipoxygenase, 5-LOX. So if I want to inhibit cyclooxygenase, I use what we call NSAIDs. So NSAID is non-steroidal anti-inflammatory drugs. The non-steroidal anti-inflammatory drugs, when you give a patient NSAID, you are inhibiting what? COX. So which means I want to what? Inhibit inflammation. So if I want to inhibit the formation of prostaglandin, I give the patient NSAID. So when I give the patient NSAID, I'm inhibiting COX, thereby inhibiting prostaglandin. So example, you have aspirin, ibuprofen, diclofenac, ketorolac. These are drugs. You need them in your pharmacology. So if I give the patient what we call leukotriene medications, anti-leukotriene medications are what? Leukotrienes inhibitors. I get it now. So example of leukotriene inhibitors is what? Montelukast, zefalucas, and zeolithium. Montelukast, zefalucas, zeolithium. These are what? They inhibit what? 5-LOX, which is 5-lipoxygenase. Because only as you get him, leukotriene is released during inflammation, I get it now. Urine inflammation, basically, I told you leukotrienes is usually good. Also, it's released during what? Allergic reactions. Because during allergy, if you go watch my video, during allergy, what happens? Your body releases what? IgE. When your body releases IgE binds to the mast cells. I get it now. So in releasing IgE, your body also make leukotrienes too. So these are vasodilatory toxins, so they are so bad. So using NSAIDs, I inhibit COX. Using leukotriene inhibitors, I inhibit what? LOX. So important note here is that COX secrete what? Prostaglandin. COX secrete what? Prostaglandin, and prostaglandin helps to secrete mucus in the GIT. I get it now. The mucus help to protect the GIT tract from what? HCl. And the LOX, I get him now. The LOX help to increase inflammation and allergic reaction. And do you know the allergic symptoms? There will be bronchoconstriction, increase in mucus secretion, vascular permeability. We'll be talking about them soon. I get him now. So the next one here we'll be talking about is the word prostaglandin. Now the prostaglandin is very important because this video will also help in your autocords prostaglandin analogs video. Now, one thing you have to know that your prostaglandin is a physiological active lipid compound. So it's a physiological active lipid compound which is derived from arachidonic acid naturally. It's a derivative of arachidonic acid from what? COX, cyclooxygenase. So when you activate cyclooxygenase, you are breaking down arachidonic acid to prostaglandin. I get him now. So it is a local hormone. It is a local hormone. Very important. So since it's derived from eicosanoid, so eicosanoid 20 carbon arachidonic acid, 2 COX, I form what? Prostaglandin. So what are the characteristics here? Number one, it is 20 carbon unsaturated fatty acid. It is 20 carbon unsaturated fatty acid, and also it has a 5-membered ring. So it has a 5-membered ring. You see it, 5-membered ring. It is produced in almost all body tissues locally, almost in all body tissues, and they are locally at the site where they are synthesized. So they are released. It's not that they are produced and they start moving around. No, every tissue produces it and they release them to that place. That's why they call them autocoids, local hormones. 20 carbon unsaturated fatty acid, derivative, 5-membered ring, secreted by all cells locally. Are you getting them? And they have short half-life. Secreted locally by all body tissues, 5-membered ring, 20 carbon unsaturated fatty acid. Now, some important prostaglandin derivatives are prostacyclin, you have thromboxane A₂, you have prostaglandin E2, and you have prostaglandin 2 alpha. So you have prostaglandin F2 alpha rather. So these are receptors of prostaglandin. We call them prostanoids. I get them now. They call them prostanoids because they are prostaglandin derivative. The first prostaglandin derivative we'll talk about is prostacyclin. We'll call it what? PGI₂. In PGI₂, they are produced mainly by the word vascular endothelial cells. So they are released inside the word endothelium of the blood vessel. First one, PGI₂, prostacyclin. They are produced in the endothelium of the blood vessel. And when they are produced in the endothelium of the blood vessel, they cause vasodilation of the blood vessel. So prostaglandin in the blood vessel causes vasodilation toward prostacyclin, which is PGI₂. They inhibit platelet aggregation, so they don't want platelets. They vasodilate the blood vessel, they don't want platelets. Are you getting me now? And they help to maintain blood flow. Take for instance, there's increase in blood pressure. So when prostacyclin is released, what happens? It vasodilates the blood vessel, dropping the blood pressure. And their work is to oppose thromboxane A₂. So they oppose thromboxane A₂. So thromboxane A₂ helps in vasoconstriction, and thromboxane A₂ helps in platelet aggregation. So they counterpose it. So the next one is thromboxane A₂. So which is, you can call it TXA₂, TSA3, TXA4. I get it now. So the first one is prostacyclin, which is PGI₂. In thromboxane A₂, what happens? They are released by platelets. So the endothelium of the blood vessel secretes prostacyclin, while the platelets secrete thromboxane A₂. And their work of thromboxane A₂, in the first rule of homeostasis, stoppage of blood, what happens? You secrete thromboxane A₂ for vasoconstriction of the blood vessel alongside serotonin. Also, if it covers the blood vessel, the body will now start doing adhesion and aggregation. Von Willebrand factor will help in adhesion, converting inactive platelet to active platelet. after you vasoconstrict and reduce the blood loss. Then the next thing is that thromboxane A2 and platelet activating factor will start aggregating the blood clot. So one is vasoconstriction of the blood vessel, platelet aggregation and clot formation, and it's important in hemostasis. And it counters what? Prostacyclin. So prostacyclin counters thromboxane A2, thromboxane A2 counters prostacyclin. Especially when there's increase in clot formation, especially when the patient is hypercoagulable, forming clots, and clots can cause different thrombosis, can cause anything, because it can dislodge, causes thrombosis, embolism, and co. So when there's too much clot formation, your body secretes prostacyclin to inhibit platelet aggregation. But when you are not forming clot, especially during bleeding, your body induces thromboxane A2 formation. Prostaglandin E2, we call it PGE2. So prostaglandin E2, which you call PGE2, it causes vasodilation. The same thing, it causes vasodilation of the blood vessel. It produces pain and fever during inflammation. I get it now. We call it inflammatory pain. So it's produce inflammatory pain and fever during inflammation. Why? Because immediately there's vasodilation of the blood vessel, or maybe when there's a pathogen in the blood. Anytime there's a pathogen in the blood, the pathogen increases chemotaxins, and that chemotaxin does what? Go to the brain and release or bind to what? The PGE2 analog. So the PGE2 analog of the prostaglandin does what? Increase what? Inflammation by increasing fever. So one thing that in the brain you have what we call the osmoreceptors in the brain, and the osmoreceptors in the brain are sensitive to prostaglandin. And which part of prostaglandin? PGE2. So PGE2 helps to what? Change the hypothalamic set point, thereby increasing the what? Body temperature, causing fever. So one, vasodilation of the blood vessel to prostacyclin and PGE2. Two, causes pain. Why causing pain? Because you are releasing what we call painful metabolites, which is histamine, bradykins, leukotrienes. These are our pain metabolites. They irritate the blood vessels. So when they irritate the blood vessel, what happens? You cause pain, you cause fever during inflammation. They increase gastric mucus secretion. There will be gastric mucus secretion. Why is the gastric mucus secretion? To what? To inhibit action on HCl on the gastric mucosa, because it can destroy it. Also, PGE2 helps to what? Cause cervical dilation. Cervical dilation, especially when the baby wants to come outside, so there will be cervical dilation, and also promote what? Contraction of the uterus, alongside oxytocin, to help in what? Delivery. The next one is prostaglandin F2 alpha. Prostaglandin F2 alpha, what we call PGF2 alpha. In PGF2 alpha, what happens? This is mainly for the uterus, because in the uterus here, there is smooth muscle contraction of the uterus, because it's present in the uterus alongside with PGE2. So PGE2 is there, F2 alpha 2 is there. So it helps in uterine what? Contraction. It helps to increase labor. Are you getting me now? So with PGE2, labor is increased. I get him now. And also during menstruation too, due to the blood coming outside, because there must be contraction of the uterus to remove the dead part of the endometrial stroma, because there's a dead part due to vasoconstriction of the blood vessel. Anytime that there's menstruation, the body reduces estrogen and progesterone. When you reduce estrogen and progesterone, there will be vasoconstriction of the uterine blood vessels, and will not supply the outer part of the endometrial stroma. And if it doesn't supply the outer part of the endometrial stroma, they will be what? Necrosed. And when they are necrosed, we need prostaglandin to start pushing them out. This is what we call menstruation. So in the uterus, for uterine contraction to induce labor, I get it now, for menstruation. Next one is I constrict the bronchi smooth muscle, because anytime there's an inflammation in the body, the next thing that will happen is that the F2 alpha in the bronchus will cause what? Bronchi constriction. And the bronchial constriction will inhibit airflow, and as bronchial constriction is occurring, there's increase in mucus secretion, because here we are stimulating the parasympathetic activity on the bronchus. So in parasympathetic activity, there's what? Bronchial constriction and what? High increase in mucus secretion. So also F2 alpha is present in the uterus, is present in the bronchus. Are you getting me now? First of all, very, very important. Also used clinically, F2 alpha is used to what? Induce labor and terminate pregnancy. So F2 alpha is present in the uterus and mainly in the bronchus. While PGE2 is present in the blood vessel, present in the brain, present in the in the uterus also. Thromboxane A2 is present in the platelets. It helps in the blood vessel for vasoconstriction and platelet aggregation. Prostacyclin is present mainly in the blood vessel. Yeah. So what is the general function of prostaglandin? What is the general function of prostaglandin? Number one, prevent or conception. So it helps to terminate pregnancy. I get him now. Terminate pregnancy. Doesn't want you to what? Form baby. Why? Because when you increase prostaglandin, what will happen? Prostaglandin will do what? Increase progesterone. So increase in prostaglandin will do what? Increase progesterone. So what will your body do? Your body will inhibit implantation by causing contraction of the uterus, and excess contraction of the uterus will do what? Prevent the cleaved fetus, the cleaved zygote that is undergoing cleavage up to the 6th day to implant. So implantation will not occur. Due to why? Because the uterus will be hostile for it. So when you are increasing prostaglandin, what happens? There's excessive contraction, and when you have excessive contraction, what happens? The blastocyte cannot implant, and if the blastocyte cannot implant, there's no pregnancy. Promote labor. So how does it promote labor? Simple. It does what? It increases what we call uterine contraction, especially in towards labor time, when the cervix have dilated already. When the cervix is dilated, usually at the 40 weeks, 36 to 40 weeks at the 9 months, what happens? It promotes parturition by increasing contraction of the uterus alongside what? Oxytocin. When there's high oxytocin and high prostaglandin, especially the F2 alpha, what happens? There's increase in what? Parturition. So the baby will be told to come outside. So it terminates pregnancy. First of all, it inhibits conception, which means you will not even be pregnant. You will not even be pregnant because, like I said, it increases it increases the uterine contraction, thereby blocking the cervix. So cervix will be blocked. When the cervix is blocked, what happens? The sperm still cannot even enter because the womb, the cervix, and the fallopian tube will be hostile for the sperm, preventing conception. It terminates pregnancy. How does it terminate pregnancy? The same thing, making the uterus hostile for the blastocyst, so the blastocyst cannot implant. So prevent conception, terminate pregnancy, but it is also released during the late stage of labor to induce parturition. The next one, increase gastric mucus secretion. Are you getting now? Because the enterochromaffin-like cells to secrete what we call prostaglandin. Because in that place you have prostaglandin, especially PGI₂. PGI₂ is present in the stomach. What does it do? It increases mucus from the mucous neck cells. So when you increase mucus from mucous neck cells, it will go around and cover the gastric mucosa. When it covers the gastric mucosa, anytime HCl is secreted from the parietal cells, HCl will not damage because HCl is always secreted every time, especially 6 to 8 hours every day. Like 6 to 8 hours every hour. Like after in a 24-hour period, 6 to 8 hours, your HCl is secreted. And anytime you have the consumption of food, neural factor. So when you think about food or you smell food, are you getting now? Anything, your body will secrete HCl. So HCl is always secreted. That's why they said you have to eat 3 times a day. But when you are secreting enough HCl and your mucus is not protecting your stomach, what happens? It will damage the mucus wall, causing what? Peptic ulcer. Prostaglandin helps to alleviate excessive nasal secretion. The next one is what? Control inflammation and blood pressure. Remember, every time there is increase in inflammation, there is any pathogens in the body, are you getting now? There will be what? Inflammation. Inflammation will occur, causing dilation of the blood vessel. Because why? The hypothalamic set point will change, increasing the what? Body's temperature, causing vasodilation of the blood vessel. There will be sweating. Are you getting now? So at this particular point, the blood pressure is dropping. The blood pressure is dropping. So the body can do it during inflammation and also do regulation of blood pressure. So the next one is alleviate asthma attack. Alleviate asthma attack because naturally we know that using F2 alpha causes bronchi constriction. Are you getting now? It causes bronchi constriction. So in patients with asthma attack, somehow an high amount of prostaglandin during inflammation will constrict the bronchus, but at a low amount there is no bronchi constriction. So to some cases a prostaglandin analogs, when giving any prostaglandin analogs to counter this effect, what happens? It can help to relieve asthma attack. It increases cyclic AMP in platelet, thyroid gland, anterior pituitary gland, fetal bone, and what? Corpus luteum. So when you increase cyclic AMP, it can favor some hormonal actions in this part, because some hormones work here, especially in the bones. Parathyroid hormone and calcitonin works here. In the anterior pituitary gland, some anterior pituitary hormone also uses cyclic AMP, but it decreases cyclic AMP in the renal tubules and the adipocytes. So it decreases cyclic AMP in the renal tubules, adipocyte, but increase cyclic AMP in platelet, thyroid gland, anterior pituitary gland, and the rest. So the last but not the least is leukotrienes. So what are leukotrienes? So leukotrienes, just like prostaglandin, leukotrienes are what? Eicosanoid. They are derivative of eicosanoid. By breaking down or by oxygenating arachidonic acid. So when you oxygenate arachidonic acid using what we call 5-lipoxygenase, you get leukotrienes. And leukotrienes, unlike what prostaglandin, do not have a cyclic structure. So they are 20 carbon fatty acid derivative, but they do not have structures. So they don't have a ring at all. But in prostaglandin, they have a 5-membered ring. But in this one, they do not have any ring. So they lack ring. That is one thing you have to know. Are you getting now? So also they cause vascular permeability. I told you they are released during inflammation, and when they are released during inflammation, what happens? They cause vascular permeability by opening up the capillaries. Opening up the capillaries is good because we have to recruit white blood cell to come and destroy the pathogens. Are you getting now? So when you increase white blood cell to destroy the pathogens, because white blood cell cannot pass through the vascular capillaries. Why? Because they are too big. So what happens? You have to do inflammation to vasodilate the blood by releasing leukotrienes, histamines, bradykines. But in the smooth muscle, they cause contraction. They cause contraction of the smooth muscle of various organs. They are important regulator of what? Inflammatory response and hypersensitivity. Are you getting now? Also, they promote inflammatory reactions, like I said, by mobilizing white blood cell to the area, macrophages, in cytokines, fibroblasts. They are inducing inflammatory reactions. They play a major role in asthma and allergic condition. Why? Because during asthma and allergic condition, when IgE binds to the mast cells, what happens? It releases histamine, bradykines. Also, leukotrienes are also increased. But this now enter the blood vessel, drop the blood pressure, vasodilate the blood vessel, decrease the heart rate, increase the heart rate and the cardiac output, and does what? Causes bronchial constriction, increase in intracranial pressure. So many things will be occurring during these inflammatory reactions. Also, asthma, it worsens an asthma condition because in asthma the bronchus is constricting anytime it sees the allergen. So anytime there's an allergy, there'll be hypersensitivity reaction, and when there's hypersensitivity reaction, what happens? There'll be bronchial constriction. And when there's bronchial constriction, what happens? The patient will not be able to breathe, or the individual will not be able to breathe. So what happens now? In asthma and allergic condition, you release leukotrienes. It also increases mucus secretion in the respiratory tract, because anytime there's bronchoconstriction, just like the prostaglandin, what happens? It helps to what? Increase mucus secretion. And it's also bad because when you increase mucus in the lungs, what happens? Air will not be able to enter into the alveolar to enter into the blood vessel. So what happens? It will increase mucus barrier. Mucus barrier will prevent the air from reaching the blood. So as far as there's increase in mucus, there will be increase in blood air barrier. And when there's increase in blood air barrier, there will not be there will not be reperfusion of blood. The clinical significance here is that excess leukotriene production causes so many inflammatory reactions, especially in the respiratory tract. So we have asthma, we have allergic rhinitis, whereby you'll be increasing mucus secretion and you'll be having catarrh. Are you getting me? So you have asthma too. So an asthmatic condition is another one. In asthmatic condition, what happens? There'll be vasoconstriction there'll be bronchial constriction of your bronchus, decreasing air flow. Are you getting me now? But to inhibit it now, you have to give the patient Montelukast and Zevalukast. Montelukast and Zevalukast blocks leukotriene's action. So all those symptoms you see leukotriene is doing, Montelukast and Zevalukast will inhibit it. But when you give the patient zeolithium inhibits 5-lipoxygenase. So zeolithium inhibits 5-lipoxygenase, while Montelukast and Zevalukast does what? They what? Inhibit and reduce the leukotriene what? Symptoms. So we call them anti-leukotriene what? Medication. So I hope it all makes sense to you and you have understood everything I said. When you reduce cell membrane phospholipid, you get what? Arachidonic acid. Using what? Phospholipase A₂. So phospholipase A₂ hydrolyze cell membrane phospholipid to what? Arachidonic acid. Arachidonic acid oxygenates itself by using COX, cyclooxygenase, to give you what? Prostaglandin, and 5-lipoxygenase to give you lipotrienes. Prostaglandin gives you a derivative called what? Prostacyclin, Thromboxane A₂, Prostaglandin E2, Prostaglandin F2 alpha, while leukotriene just give only, you have leukotriene LT4, LT5, LT6. They have many leukotriene receptor on different parts of the body. Are you getting me now? So you inhibit phospholipase A₂ by what? Corticosteroids. You inhibit cyclooxygenase by what? NSAIDs. And you inhibit leukotriene symptoms and 5-lipoxygenase by what? Montelukast, Zevalukast, and zeolithium. So if you are new to my channel, make sure to subscribe and turn on your post notification button, so at any time I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you. So we'll be moving to the next, which is what? Cholesterol metabolism. I want you to watch the next topic. Follow me every day, every time. Don't forget. Bye bye.